Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
In collaboration with Boise State Public Radio, the Community Library presents a new podcast, Sheep Stories. I'm host Vance Cunningham. Join me as we listen through the archives of the Trailing of the Sheep Festival to learn about the Scottish, Basque, and Peruvian immigrants foundational to the sheep herding industry over the past century. Hear their stories of traveling to Idaho and learning the language of the sheep. Find Sheep Stories wherever you get your podcasts and at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. You're listening to Idaho Matters. A new joint investigation from NBC News and Stanford University finds that childhood vaccination rates across the United States are slipping. Since 2019, 3/4 of U.S. counties have reported drops in how many children receive required immunizations. Vaccines like MMR, which is the measles, mumps, and rubella vaccine, are no longer reaching the herd immunity threshold in a majority of U.S. communities. And as exemptions requests rise, public health experts are warning that diseases that were once eliminated are creeping back. So here's the question. What does that mean for community health? Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, what stands out to you the most in this Stanford NBC investigation about childhood vaccination rates nationwide?
Well, there are a few things. I mean, first of all, if you look at least a lot of the public polling that I've seen, you would not imagine that significant number of American parents would decide not to get their children vaccinated. So that is a bit surprising. My guess is that a lot of that is not parents themselves that are quote unquote anti-vaccine, but rather they're just confused by all of this. And I think human nature is, if we're not sure what the right decision is, then don't make a decision, but we don't contemplate that that's actually making a decision and could have consequences. The second thing is maybe it's because I just don't know a lot about St. Louis, but I was really shocked to see that was one of the lowest vaccine areas. I think it's just, this is a very bad sign of what is to come. And we know the answer. This is not one of those movies where we're going to be glued to our seat just waiting to, what is going to happen. We know what's going to happen, and it's going to be tragic.
So we know that Idaho ranks at the very bottom for MMR and DTaP vaccination coverage. I'm talking at the bottom in the United States. Dr. Pate, from a medical perspective, I mean, how serious is that?
Well, it's very concerning. So first of all, we do have to understand that with the Idaho numbers, they may look worse than what they are. And here's why. It's because parents are allowed to opt out from having the data even reported. That does not necessarily mean they didn't get their children vaccinated, but they think, I don't want the government to know. And so I'm hopeful that our actual vaccine percentages are higher than what we see. But here's what it means. Even if it is in the ballpark, as that article you referenced is talking about, there are certain infections that there is herd immunity. And just to remind your listeners, what herd immunity means is that there are enough people that are vaccinated and immune from infection that those among us who are either too young to be vaccinated or have medical conditions for which they can't be vaccinated or won't have a good response, they still are relatively protected because so many people are vaccinated that the virus can't really circulate among us, and therefore it helps of those people avoid getting infected. Now, that doesn't happen for all or even most infections, but it does happen for some, and most notably measles. But there are other infections, and you mentioned diphtheria, tetanus. Listen, I've never actually seen a case of either. I've studied them, I've seen pictures, I've watched videos, I know about them, but I've never seen a case. Let me tell you, you do not want your child to die that way. This is not just an infection. One, the diphtheria is a terrible, thick, very difficult to remove membrane that occurs in the back of the throat, and the child actually suffocates. And the other, tetanus, is a toxin from that bacteria that causes damage to the neurologic system, and it is excruciating for the patient, and it's excruciating to watch somebody with tetanus. These are dreadful diseases, but we should remember that if we are becoming susceptible to measles, and we're seeing that in the United States, we're having the most number of cases of measles circulating than we've had in decades, and it clearly shows that we're vulnerable, but that means there's some other diseases, rubella, that may not be far off because that one, although we pretty much eliminated that from the United States, that one infects pregnant mothers and causes terrible birth defects or loss of pregnancy. Mumps, people think about that infecting the parotid glands, the salivary glands over your cheeks, but it also infects ovaries and testicles. And at least in men, that can lead to infertility and lots of other lifetime consequences. And I think it's very sad to think that we're going to have to get a whole bunch of kids infected who die or have complications that they are going to bear the brunt of for the rest of their lives before us adults can realize, oh, we made a grave mistake.
So, Dr. Payne, I want to go back to something you mentioned, and that is the full proof of immunization. So, according to Idaho Education News, in the 2024-25 school year, more than 25% of Idaho kindergartners attended school without that foolproof immunization. So that reporting rate for kindergartners in that academic year was 74.8%, making us one of, I believe, the lowest in the nation. Now, with that said, Dr. Pate, what stood out to me with what you said is that doesn't mean necessarily that that's the amount of children that are vaccinated. I will tell you this, from my own personal experience, I actually would need to go back and see in my kids' school records if their immunization records are uploaded to their school profile. And here's why. It's really, I mean, at least, for me, maybe other people are smarter. It was really difficult to try to figure out how to get their vaccination records electronically and then transfer them electronically into the electronic system at the school, because at least where my kids go to school, I can't just physically walk in anymore and give them the paper. Everything's electronic. And I know at one point I was kind of like, well, they're vaccinated, whatever. I can't figure this out. So I make that point saying that, yes, we need to pay attention to these numbers, but there is a possibility, maybe not to herd immunity, that our numbers are higher than we're seeing.
Yes, and I pray they are. Gemma, what you need to do is what I do is I just get my 10-year-old grandson to come over and help me
right.
with electronic things. But yeah, I do think the levels are higher than what's reflected there, because I think we would have seen more widespread outbreaks than we've already seen. But with that said, if it's even in the ballpark, we are going to have outbreaks. And I think the other troubling fact is I'm basing my thoughts on what has happened in the past. But as that article you mentioned addresses, those rates are continuing to decline. And I think that's because all of this vaccine disinformation, especially now that RFK Jr. is our Secretary of Health, it is so much more than we've ever seen before. And we are getting ready for a clown show the next 2 days when the Advisory Committee on Immunization Practices for the CDC meets, now that it has been completely replaced. And we've got basically people that are either seriously misinformed, or they don't understand, or they're bad faith players that are now staffing this committee. And we saw a little bit of that last time. It will be much worse tomorrow and the next day. And I think we are headed for real trouble. And I think a lot of the public is just going to be extremely confused.
So, Dr. Pate, in your opinion, what kinds of outbreaks would you say that we would be most at risk for if these numbers don't improve? I mean, are we looking at, more cases of the measles as we saw in Texas, and then how it spread to other parts of the country?
Yes, I think what we can do is we can make a very educated guess as to what we will see based on which, for those various viruses or diseases, which ones are the most contagious and which ones require the highest level of community vaccination. So measles is always the first. That's the canary in the mine. You're going to if you're going to see anything first, it's going to be measles. And what I do is I look for where's the outbreak happening and how big is the outbreak. If as our vaccination levels go down, what we will see is we'll see measles outbreaks, so we can look at those areas and know that we've got vaccination problems there. But how big is it? If it's just a family, then we had a little bit more than that a couple of years ago in Nampa with a measles outbreak, then that's a reassuring sign. But if it's spreading in the community, and like you have what Texas did, where we have hundreds and thousands, and now you start having a bunch of kids showing up in the hospital with it, now you've got a really big problem. After measles, what my concern is that pertussis, and we've already seen a few of those outbreaks. You and I have discussed those in past years, so I think that would be next. Then you got to get down a significant bit lower before we see rubella. That is going to be really sad because I think these moms that get pregnant are not going to realize and especially women that are childbearing today, they won't know what rubella is, never have heard of it or seen it. That's going to be tragic. I think the other one that I'm watching to see if RFK Jr. and the CDC is going to go after it. If that happens, it's going to be really bad. And that is the Haemophilus influenza B, or HIB vaccine. And that is a disease I've seen a lot of. In fact, when I was in practice, it was very common to have children admitted to the hospital daily with those infections. And those infections are life-threatening, potentially, in children. And we came out with this vaccine for it. And now pediatricians in the hospital rarely see those cases, but that will fill up, and that could cause even capacity problems in our children's hospitals. We don't have a lot of children's hospitals beds in Idaho. So lots of things that I'm going to be watching for, and it just kind of depends on what the list of vaccines priority that RFK Jr. is going after. It appears that the next 2 days they're going to be going after the COVID vaccines, hepatitis B vaccines, and there was another that they're going to look at. So I'm watching that.
And we should note that right now on Capitol Hill, if you're listening live, is that the former CDC director, Dr. Susan Menarez, is testifying under oath, giving her side of what happened when she was let go. So, of course, we'll discuss more of that next week, along with that upcoming ACIP meeting, which is set for tomorrow and Friday. But with that said, Dr. Pate, at what point does the lack of vaccinations in a community cross into like a true public health crisis, right? Where I think there's an idea that, these aren't that serious. We're doing better for our kids by not doing this. But at what point does it really start to become a public health issue?
Well, we can look at the measles outbreak. I think it was 3 or 4 years ago in, I believe it was in central Ohio. It was going through daycares, and it was such a big outbreak because there was a cluster of families there in that geographic area that used the certain same daycares because they didn't require vaccination. And there was a big measles outbreak. And what happened is it was so big that we had a number of children admitted to the hospital. And of course, if enough get infected, you will have a child die. And what happened was just terribly heartbreaking. But the parents of some of those children that died actually went on TV and radio to talk to other parents and say how terrible this was, that they had been duped, they had believed anti-vaccine rhetoric, and now they've lost their child. Obviously, that kind of thing in a local community is very impactful. The other thing that happened is we just had a child in California die of the rare complication from measles that we've talked about on this show, SSPE, which is subacute sclerosing panencephalitis, which is a particularly terrible development because your child gets infected, they seem to recover, and then 3 to perhaps 10 years later, all of a sudden, that child starts neurologically deteriorating, and it's progressive, it's fast, and it is incurable, and they invariably die. And I think when children start dying again, we'll get a lot more visibility to this issue. People will realize that there was a mistake. So I think that will be the case. The other thing is, remember that a lot of these infections are spread in daycares or schools. And then what will happen is children will take these infections home. And what we will see is, like we're seeing with the current measles outbreak, 20-some% of those cases are happening in adults. And adults typically can have a far worse course. And we'll start seeing perhaps some parents who are have a lot of underlying health conditions or might be immunocompromised. And now we see children becoming foster children or orphaned. And we could see things like that, and perhaps even school closures to address some of these outbreaks. So it will not take long. It will take a while, but we will start seeing what we used to deal with back in the 50s and the 40s and 100 years ago. And that is going to be dreadful. But I'm just of the opinion that that's perhaps what it's going to take to wake us up.
So Dr. Pate, Jill wrote in and she says, I know Dr. Pate said that we should wait to get flu shots until there are cases in our area, but we are leaving in early October for 2.5 weeks to Europe. Should we get a flu shot before we leave? We are up to date on COVID vaccines. We are 71 and 68 years old.
Thank you. That's a great question, Jill. And yes, I would recommend that you go ahead. A lot of times, I'm not sure where in Europe you're going, but a lot of times Europe does start to get their flu season just a tad bit earlier than we do. I don't know what's going to happen this year, but given the time that you're going to be traveling and how long you're going to be there, and the fact of your age, and I don't want you getting influenza over there and having to get medical care. I do think that you should get your flu shots. Remember, at your ages, you need the high dose flu vaccine, but I would get the flu vaccine for you before your travels. My advice that I gave before was more for the general population who is not going to be internationally traveling, but waiting to determine when to get their flu shot here. And because the flu vaccine protection does wane a little bit each month, we want to try to get you through the whole flu season with your vaccine. And that's why I'll be monitoring that flu activity and tell you when I start to see it that, okay, now it's time. It's probably going to be late October or early November. If you're the kind of person that you're not going to make a special trip in for your flu vaccine, but you're going to be seeing the doctor, then yes, go ahead and get your vaccine because I'd rather you have it than not. But for those that are willing to go in and try to time this, we'll give you the heads up on this show.
Jillian wrote in as well, and Dr. Pate, she has a couple of questions in regards to trying to clear up some confusion that she's had about when adults need to get vaccines and boosters. So her first question is this: how often should we get a tetanus shot?
So generally speaking, for the vast majority of people, you should be getting it every 10 years. And you can get that in two different forms. Well, actually, you can get just tetanus, but what we usually recommend is get the tetanus with the diphtheria, which is TD, and you get that every 10 years. Or if you are someone, you're a school teacher, you're a daycare worker, you are around kids, you have young grandkids, or you're expecting young grandkids, then get the Tdap, which is the tetanus, diphtheria, and pertussis. And so get one or the other every 10 years.
And then Jillian says, do we need a flu shot every year?
Yes, unfortunately, the influenza virus makes major changes every year. And so you're not going to have long-lived immunity. And so you need a unique flu vaccine every year. The good news is that we are finding very good evidence that by getting that flu vaccine and avoiding influenza, you're actually decreasing some of your future health risks. So, but every year.
Who should get a pneumonia vaccine and how often?
So generally speaking, everyone should consider getting the pneumonia vaccine. It goes by a lot of different names, commonly Pneumovax, but there's other names. But generally, everyone should consider getting a pneumonia vaccine at the age of 50. Now, I say generally, and that's because if you have underlying medical conditions that put you at particular risk, and for the pneumonia bacteria that this vaccine is for, one of the big risk factors is your spleen. So if you've had a condition where you've lost your spleen or your spleen doesn't work, you particularly need that, and you might need that very early in your life, depending on what the condition is. But for the general population, 50. But if you have an underlying medical condition, especially one that would impact your immune system, be sure to talk to your doctor at any age about whether you ought to go ahead and get it early.
Okay, here's another question from Jillian. Who needs a shingles vaccine? How often? And do you need it if you didn't have the chickenpox?
Really, great question. And the reason that's a very insightful question, because the reason that we take the shingles vaccine is to protect us from a condition. Most people know it as shingles, but in the doctors, it's varicella zoster, which is part of the chickenpox complex of infection that you get usually when you're young. And so the risk for developing shingles is because you've had that prior infection. But the recommendation is to get shingles vaccine regardless of whether you are aware that you've had chickenpox before, because you continue to be at risk for chickenpox. And the fact is that as you age, your risk for shingles will go up, and that risk becomes very high with age. For example, in my age group, it's a very high risk. So what we do is we recommend that you get the shingles vaccine starting at age 50. It's generally a 2-dose series of recombinant zoster vaccine. The trade name is Shingrix, and generally you need to get it 2 to 6 months apart. But generally that will do it. So you don't have to get a booster later, but do get that. You do not want to have shingles. And we have just had a study come out in the past few months that showed if you get that shingles vaccine, it lowers your risk of dementia. And that's probably because we're finding that more and more viruses do play a role in whether we end up getting dementia. And by preventing that varicella zoster from erupting, you're actually decreasing the chance that's going to inflame and scar your brain.
And Dr. Pate, I will say this. My husband got shingles in his late 30s. And we're talking 14 years later, he still deals with issues from it. I mean, he got the shingles vaccine. But, as you said, this isn't something you want. He got it in his head. It traveled close to his eye. I mean, it can be really much more serious and dangerous, I think, than folks might know.
Oh, yes. In fact, what you're describing in your husband, it is dreadful. And it sounds like he was close to developing a condition we call the Ramsay-Hunt syndrome, which is where the shingles actually doesn't affect the eyes. It can be even worse, and that can be life-threatening. So it really, first of all, it's not fun no matter what to have shingles. It's very painful. It can be very unsightly, but it can be very serious, as in your husband's case. You can have long-term pain syndromes from it, and certainly there are some versions that can literally be life-threatening.
Before we go to break, Jillian had one more question about vaccine confusion, and this is about the hepatitis vaccine. She wants to know, do you need it to travel overseas, and do you need boosters for it?
So it depends. I'd have to know what country you're going to. The biggest risk is hepatitis A, and that is a waterborne infection. And that would be if you're traveling to Southeast Asia, Bangladesh, India, Nepal, Pakistan, some of those countries where hepatitis A is endemic. Then you would need to get the hepatitis A vaccine, which is a 2-dose series. And you need to plan far ahead, because ideally, that we do have a way we can accelerate it, but ideally we'd like to have at least 6 to 12 months ahead so that we can give you a booster to it. Hepatitis B is a more serious infection, but not as prevalent. And that is going to be like if you're traveling to sub-Saharan Africa or North Africa, the Far East, Central America, South America, Middle East. There might be some places that, depending on which countries you're going to, we would recommend hepatitis B, and that requires 3 doses. And ideally, we'd like to have 6 months to spread those over. And if you have not had either one of them, there is an opportunity to give you a combination vaccine for hepatitis A and B. But so the answer is it depends. It depends on where you're going. So check the CDC website, or like a listener asked us a couple shows ago, that listener went to Travel Medicine. That's a great place that they can look up and tell you exactly what you need.
So, Dr. Pate, I want to go to a question that Anne has. She was listening last month, and she says she thought that we said that 30% of all medical providers have left the state. So Anne says, my friends and I are wondering if I misheard, and the statistic is 30% of OBGYNs, and she's hoping we can tell her which one is correct.
We can, and Anne, I hope you didn't place a wager with your friends. Unfortunately, well, actually, fortunately, for those of us, but not for you, your friends are right. It was OB doctors, not all doctors.
Okay. Now, Philip sent us a question as well, and he says, since healthcare outcomes are important to everyone in Idaho, then why doesn't Idaho participate in the major healthcare outcome and quality measures, such as programs like the National Inpatient Sample by the Agency for Healthcare Research and Quality? Many of these measures are optional. Interestingly, Idaho is only one of 4 states in the United States which does not participate. So Philip says, why is that? And Dr. Pate, I will say this, that question is way over my head.
Well, I understand. In fact, I was just going to say, Philip, you really get some extra credit because very few people know about that. Philip, the short answer is I don't know, because that decision was made before I came to Idaho in 2009. So I don't know why Idaho decided not to participate. I can make an educated guess. In fact, had I been here, I probably would have sided with not participating. The reason is that is a system that really is predominantly used to help researchers look at healthcare utilization and cost and issues like that. The problem for me as a health system CEO is that all the data is de-identified by the hospital and even by the state. And so what that means is that I would have to actually invest some resources to report the data, but it's of no use to me. Because what I want to know is, well, how are my hospitals doing? What are areas I can improve? And frankly, we have so many other choices where we get really actionable data. And frankly, with much more sophisticated quality measures and safety measures, things that I can really impact patient care with. So I can guess why, but I don't actually know the reason why. But I certainly don't fault Idaho for making that decision.
So this next question is from Brian, and he says he really appreciates the Dr. Roundtable, and he was listening last month. So he sent this question in regarding a discussion that was had about Alzheimer's and animal models. He says, Dr. Pate mentioned that animals don't get this particular disease. So Brian says, well, I recently heard on an interview with a scientist who published a paper discussing their research on feline dementia and the similarity with Alzheimer's in humans. So Brian is interested in knowing more because the study says, and Dr. Pate, I'm quoting here from the study. So, quote, pathologies similar to those observed in Alzheimer's disease have been identified in the brain, unquote, of older cats. So Brian's question is, are we seeing some evidence that animals might get Alzheimer's as well?
Well, just like with Philip, Brian, you get an A+. That is amazing because that study actually just came out last month, and I had missed it, and it might even been after our radio show segment. But it is a really important study that you pointed to because based prior to that, based on studies that we had, what I said would be the case. We really don't have a very good model. What's so important about that particular study is that that is the first time, to my knowledge, that they have been able to link those beta amyloid plaques in the cats to inflammation and some neurodegenerative changes. So it is possible, I'm not convinced yet, but it is possible that that may be a model for us to look at. I think another interesting thing is if you look at some really long-lived mammals like whales and dolphins, they get some similar things. The problem why I didn't commit that there is an actual Alzheimer's disease in any other animal is it's not enough to have the beta amyloid plaques. In fact, the cat plaques are very different than the human plaques. Humans in Alzheimer's disease, we tend to get very dense plaques in a specific locations of these cells, whereas the cats, their plaques tend to be more diffuse and not so dense. And so it wasn't clear that it's really the same. In fact, we're still trying to figure out exactly what does create the disease. Just because we see these abnormal findings doesn't create causation. So it's very complex, though we are learning tons, and our knowledge about Alzheimer's is growing very fast. That gives me a lot of hope. But Brian, I am so impressed that you found that article, and appreciate you letting me know about it because I had missed it. So that's a great one.
A quiet but concerning trend is on the rise. More parents are refusing the routine vitamin K shot for their newborns. The injection, which is given just hours after birth, prevents dangerous and sometimes deadly bleeding disorders. Now, a lot of doctors are saying misinformation, along with some social media myths and growing distrust of the medical system, are driving some families to opt out of this. So we wanted to take this last part of our discussion with Dr. Pate today to talk a little bit more about this. So Dr. Pate, can you explain what the vitamin K shot does for newborns and why it's recommended immediately after birth? And it is not a vaccine.
All of that's correct. So it is not a vaccine. Vitamin K is exactly what it sounds like. It's a vitamin. And this vitamin is very important to our production of blood clotting factors in our body. So the reason that I don't bleed to death every morning when I shave is because my body has a very sophisticated system to stop my bleeding. And this is very, very important. Now, for me, at my age, I'm making vitamin K all the time through my diet and through my gut bacteria. Now, the problem with a baby is that babies generally do not start solid foods until age 6 months. And they have not yet populated their guts with what we call the microbiome, the beneficial bacteria that we all have in our intestines, that these bacteria help make vitamin K for us. So in the first 6 months of life, that infant may not have enough vitamin K because you don't get enough generally, even from the mother when they're breastfeeding, that we can be sure that they're making their blood clotting factors. And of course, generally, babies don't need those blood clotting factors so much because mothers, coddle those babies, are very careful with those babies. We strap them in cars, all those kinds of things, but they're at risk. And so we give them a vitamin K shot when they are born, and that helps them make those blood clotting factors. And without it, the condition you referred to, which medical term, we call it vitamin K deficient bleeding, or VKDB. often the worst and fairly common manifestation is that the baby has even what might be considered a minor injury to their head and then bleeds into the brain. And it is terribly tragic when that happens. Could certainly result in the death of the baby or severe neurologic complications.
So here in the United States, the vitamin K shot has been given to newborns since 1961. So 64 years, Dr. Pate. And I have anecdotally heard from some pediatricians who are saying that, we've gone 60 plus years without seeing things like brain bleeds, and we are now starting to see them because of this decline in getting the vitamin K shot. Why do you think that parents are declining this? Is it? I mean, I wonder if there's this hesitation because of the information they're getting and maybe the assumption that it's a vaccine, even though it is a vitamin, and maybe not understanding what it does.
Well, I do think a lot of it is not understanding, and I feel very sorry for parents. Being a parent is a really tough job. And unfortunately, medical issues and science is complicated. It is very easy for people that make their living by spreading disinformation, particularly on social media, to put out absolute nonsense. And they can become the trusted sources for information because of the algorithms, because other people reinforce these notions that don't know what they're talking about. And unfortunately, like we were saying, parents can just get confused and think, well, I'm just not going to do it and take the chance. But you're right. Some are probably getting it confused and thinking that is a vaccination, and I don't want to do that to my baby. Some of it is because way back there, I don't know, 50 years or something ago, there was a very poorly done study that suggested vitamin K associated with cancer, which is ridiculous because we all have vitamin K in our bodies. And that study has since been refuted. But unfortunately, people will promote those bad studies. We've seen our own Secretary of HHS put out absolute nonsense studies that either don't say what he says they say, or they're just terribly designed studies. I feel sorry for you parents. I know it's tough. I know you want what's best for your child. Let me tell you, talk to your pediatricians. If you have a concern, talk to them. They might be concerned to talk to you because there's so much emotion around these things, so they may not bring up some things. But if you have a question, ask them, because your pediatrician will probably be relieved that you'll ask and want the information. You can also check the American Academy of Association of Pediatrics website. They have good information. You can check with us. There are lots of us that want you to get the right information before you make a decision that could end tragically.
I have less than a minute left with you, Dr. Pate. I mean, so final thoughts for these parents, who may be expecting right now, or who may have a newborn, on really what they should do when it comes to the vitamin K shot.
Yeah, please get that. I have seen this condition happen. Parents are devastated when this happens. It is a terrible threat to the life of the child, and like I said, is generally going to require aggressive treatment to save the baby's life, and may lead to disability of the baby, even if the life can be saved. Please, it's innocuous. The vitamin K is not going to cause cancer. It's not going to cause any bad problems. It's actually an extremely safe thing because we all have it in our bodies. And the other thing is, I know we all have great hopes for our children. Please listen to qualified experts. Get good advice.
As always, Dr. Pate, we appreciate your good advice. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. If you have questions, send us an email, idahomatters@boisestate.edu. I'm Gemma Gaudette, and this is Idaho Matters.